Hi, today we are going to discuss about polycystic ovarian syndrome. Polycystic ovarian syndrome is the syndrome of ovarian dysfunction. There are cardinal features of hyperandrogenism and polycystic ovarian morphology. In a patient with polycystic ovarian syndrome, the blood LH level is increased due to disordered ovarian pituitary feedback mechanism. And also, blood insulin level is increased due to insulin resistance. Increased LH level in the blood result in increased testosterone level of the blood, and also it is magnified by increased insulin level. The hyperinsulinemia is result in reduction in production of sex hormone binding globulin, which result in hyperandrogenism by increasing free testosterone level in the blood. The clinical features of PCOS are irregular periods, overweight, and features of hyperandrogenism like hirsutism, acne, alopecia, and also acanthosis nigricans is a sign of insulin resistance. It caused by hyperpigmented thickening of the skin folds of axilla and neck. Up to 75% of women with PCOS has infertility, and recurrent miscarriage can be due to poor endometrial receptivity and increased uterine contraction. The patient with PCOS may be asymptomatic. When we consider about investigations, the lab test will show increased testosterone, LH, prolactin, fasting insulin, estradiol levels, and also sex hormone binding globulin level is decreased, and the progesterone level is decreased due to anovulation. Rotterdam criteria is used to diagnose the condition. 2 of 3 criteria are required to diagnose PCOS. Oligoanovulation, biochemical or clinical signs of hyperandrogenism, and ultrasound evidence of polycystic ovaries. When we consider about long-term risks, the PCOS is associated with increased risk of type 2 diabetes mellitus and CVS events. Management of PCOS involves exercise and weight reduction is a first-line treatment for obese patients with PCOS, and also metformin is used for patients with hyperinsulinemia. And also it can be used for adult women with PCOS for weight reduction. Combined oral contraceptive pills is the first line therapy for patients with amenorrhea or irregular bleeding for regulate menstruation, and also it increases sex hormone binding globulin that lead to decreased androgenic symptoms like hirsutism. If the patient is not responding to COCP, cyproterone acetate, which is anti-androgen, can be used. For management of infertility, reduction of weight is considered as first-line treatment. For ovarian induction, letrozole can be used, and also ovarian drilling, a laparoscopic procedure used to destroy some of the ovarian stroma. Thank you.